Senator Andrew Cuomo's girlfriend, Sandra Lee, was rushed to the hospital last night.
The problem was described as a painful buildup of fluid in her chest area. CBS 2's Dr. Max Gomez is here with more on the type of complications women may face after similar breast surgery. Max.
That's right, Dick and Christine. You know, Sandra Lee, we know, had a double mastectomy and breast reconstruction in May. What we don't know is what kind of mastectomy, skin or nipple sparing, for example. What kind of reconstruction, implants or her own tissue, all of which impacts the kind of complications that might arise. Here's the most likely scenario. Sandra Lee has been very open about her breast cancer diagnosis, posting videos and tweets from the hospital after her double mastectomy and breast reconstruction. But now, 2.5 months later, she's suffering a complication described as a fluid buildup on her chest wall. Dr. Lauren Cassell, chief of breast surgery at Lenox Hill Hospital, says Lee most likely had breast implants for reconstruction because she's too thin to use her own tissue, which means the most likely problem is
infection. But I think the statistics place it at less than 5%, and it's only a few percent of patients who will develop it, but it is one of the things that patients are told that could potentially happen.
The fluid buildup on Lee's chest is easily drained, but the fact that doctors want to keep her in the hospital for a few days suggests that they suspect an infection, which is treatable with IV antibiotics and is a known possible complication after reconstruction.
And sometimes what they actually do is take her to the operating room, wash out the area, and if possible, exchange the implant. And sometimes if that is not successful or not possible, they may have to actually remove the implant.
The implants would have to be removed because they're foreign bodies that can harbor bacteria, making an infection extremely difficult to eradicate. But Dr. Cassell says a high-profile complication should not prevent women from seeking breast reconstruction.
Reconstruction is a very important part of a woman's body image. It is a great thing that we have to offer patients who undergo mastectomies.
Now, even when there is a complication like an infection, after treatment, the implants can usually be replaced and the reconstruction completed. Again, we don't know whether this is what's actually happening with Sandra Lee, but it is a known issue after reconstructive breast surgery.
All right, Dr. Max, great information. Thank you.